Hello, my name is Tanner Carr.
Good morning.
And I am a 5th grader at Falkirk Elementary School. This is Gloria and Dr. Burgess from Broadway Veterinary Hospital. Thank you for letting us interview you today to find out more about your career taking care of animals.
Yes, sir.
What are some reasons you have to put dogs down?
Probably one of the main reasons is we have dogs and cats both that get hit by cars and have severe internal injuries. That's the main reason. Second reason would be cancer conditions, and that's probably our two biggest reasons we have.
What is the...
Hello, my name is Tanner Carr.
Good morning.
And I am a 5th grader at Falkirk Elementary School. This is Gloria and Dr. Burgess from Broadway Veterinary Hospital. Thank you for letting us interview you today to find out more about your career taking care of animals.
Yes, sir.
What are some reasons you have to put dogs down?
Probably one of the main reasons is we have dogs and cats both that get hit by cars and have severe internal injuries. That's the main reason. Second reason would be cancer conditions, and that's probably our two biggest reasons we have.
What is the main problem with animals that come into your office?
Main problem we have come in here, the biggest problem are skin conditions. Itchy dogs, itchy cats, primarily resolves around either allergic conditions or fleas. Second to that would be diarrhea conditions or vomiting conditions in dogs and cats.
What is the weirdest animal you have ever treated?
Weirdest animal? Probably a hedgehog.
How many pets have you had die?
Oh, we had die.
Least amount possible.
Least amount as possible. That's a good idea.
You can scoot in there if you want.
It happens occasionally. Yes, it does. We try to minimize as much as we can losing any animal, of course, at all. That's not something you're here for. You're here to save life, not to actually get rid of the animal's life. So, yes, it does happen occasionally, but on rare occasions.
How many pets have you helped?
How many have I helped? Oh, my gracious. I've done this for a long time. I would probably say around, maybe 20,000, maybe something like that.
Kim, did you want to let Tanner ask some?
What kind of animals do you help?
Okay, what do we do? Well, what we do at this hospital here, primarily dogs and cats, 2 horses. I have done beef cattle work and dairy cattle work. We do sheep and I do anything pretty much except I don't do birds, I don't do snakes, I don't do monkeys or skunks.
How is having a good character important for your job?
You must have a very good character. Your clientele depends upon that. You have to have good communication skills to talk to your clients. You have to have a character that people know that they are trusting of you, and they are willing to let you take care of the animals for them. They have to be able to trust you.
How do you use reading in your job?
Oh, reading you use every day. In fact, to get to the position we have here now, you must be able to read very well. The textbooks we have, the research articles we have to go through. Yes, reading is very, very important. You must be able to read and comprehend exactly what you need to do. It's probably the most important thing.
How do you use math in your job?
Math is used every day also too. We have animals that weigh different weights when they come in here, and our doses of medications are based upon what the animals weigh. So we have to be able to weigh the animal, and then after that, base our dosing upon what the animal weighs. So you have to calculate dosages, and have to calculate then how much to draw out of a syringe or how many capsules of medication to give based upon the animal's weight. So you have to use math every time too.
Do you need to go to college to do your job?
You most definitely do. I have, after I graduated from high school, I have 8 more years of college. So it takes a long time.
Do you like your job?
I love my job, yes I do. I've done this job since 1974. It's been a long time.
Do Do you have any equipment that you would use in your job that you would like to show us?
Sure, I'll be glad to show you lots of equipment. We have several pieces of equipment I want to go through with you here today along the line.
We have had dogs and
Our
we
first
have had-
machinery here, we do dental work on the dogs and cats here. This is the same as if you all go to a dentist. We are dentists also in a sense that we have similar type of equipment. We have scalers we use to clean dental teeth as well as clean the tartar off their teeth. We have the drills we use to either not essentially fill cavities because that dogs and cats don't really get cavities and such, but we will take away tartar and take away extra particles of teeth that don't need to be there on the line too. So that's just a dental machine here. This machine here is called a laser machine. We use laser light to treat injuries like bruises, severe infections, those kind of things. That laser light actually helps to, one, to kill bacteria. Number two, it helps to reduce inflammation in tissues, increases circulation so things heal quicker. The other machine over here, the small one, this is an ultrasound machine I would take outside to do pregnancy checks on horses. We can check horses down to 20-some days on our pregnancy here to see, make sure first that they're pregnant, number two, they haven't got twins. So it's a nice portable little machine we can use to take out with this thing too. Now, the other machinery in here, of course, this is our x-ray equipment here, and this is all also all computer-based and all digital-based equipment. We use one x-ray plate, which is located here, which is wirelessly connected to all of our rest of our equipment in the hospital here then too. So once we have taken an x-ray here, taken the picture here, within 5 seconds I can actually look at it and see what's going on now.
It is recording now, so whenever you... Boys, get a little closer to Dr. Burgess. It is recording now, so whenever you... Boys, get a little closer to Dr. Burgess.
We have several pieces of equipment I want to go through with you here today along the line.
We have had dogs and
Our
we
first
have had-
machinery here, we do dental work on the dogs and cats here. This is the same as if you all go to a dentist. We are dentists also in a sense that we have similar type of equipment. We have scalers we use to clean dental teeth as well as clean the tartar off their teeth. We have the drills we use to either not essentially fill cavities because that dogs and cats don't really get cavities and such, but we will take away tartar and take away extra particles of teeth that don't need to be there on the line too. So that's just a dental machine here. This machine here is called a laser machine. We use laser light to treat injuries like bruises, severe infections, those kind of things. That laser light actually helps to, one, to kill bacteria. Number two, it helps to reduce inflammation in tissues, increases circulation so things heal quicker. These are all touchscreen type machines. We can all do we can move things around on the screen, we can touch them and make them, we can actually enhance the coloration of the screen and so forth then too. So we can see, say I want to look, this is a shoulder joint here. If I want to look at shoulder joint, I can actually magnify that shoulder joint to actually look at it more then too. Or if I want to reduce the magnification, there's a way along the line also too. So then we can warm the table up for the animals so they don't get cold during surgery. We use gas anesthetics, the same as if you go to RMH hospital and have surgery there. We use the same type of gases as far as oxygen and isoflurane that they use for anesthetic for you. Our patients are monitored on the monitor equipment here. We measure blood pressure. So the machine measures blood pressure here. We use a little cuff on the animal's arm, same as we have a cuff on you and so forth too. The other machine over here, we measure the pulse. We have an EKG, so you can actually see what the heart's doing first. We do the pulse rate. We do respiratory rate. We measure the animal's temperature, the heart rate. All these are all recorded on this machine here for us. This little probe goes down the dog's and cat's throats, so it actually picks up directly from the heart, from the body, what the body temperature and what the pulse rates are. So this is all equipment we use every day during surgery. If we have an animal, it's the same as if you go to the hospital too. They're all done exactly the same way here too. Machine over in the corner, this is a laser surgical machine. This actually uses laser light to make our incisions so we make surgery, do surgery. So rather than in some cases having to use a knife, we'll actually use the laser, which is laser light we cut with then too. So what the laser does as far as the difference between the laser and the knife is that when you cut with a knife, you have bleeding occurs. When you use the light and the heat from the light actually seals the blood vessels along the edge of your incision side, and it also deadens the nerve endings, so there's no pain at that site at the same time. So it's just new technology to do surgery. In our laboratory area, I have 4 technicians at the hospital, which are essentially nurses, what they are. We call them technicians, but they are animal nurses, are what they are. This area through here has all of our laboratory equipment. And with this laboratory equipment here, we can do, within a 10-minute period of time, we can do a complete blood count on them. We have our patients here ready this morning for dental. I think they get dental today, isn't that right?
They do.
They had to get their teeth cleaned today.
Snags cleaned up.
You've got some pretty cute patients.
Other questions?
That wasn't big or small.
Yeah, small. Yeah. They're the same owner, but they're small. Mickey and Molly. The medical ward back here. And here we go. Okay, you're fine. You're fine. We have our extra kennels back here. We have a place we can bathe the animals in here, so it's a little higher, so you have to bend over on your knees to bathe it, and we can actually stand up and take a bath in here.
Nice. You want to be on film? It's okay. It's okay. We're not going to hurt you.
Say it's people. It's people. This is our scales we weigh the animals on here. So when they stand on here, it actually gives their weight up here. And we weigh them in either pounds or kilograms. Now, most of our work is done in kilograms because that's the international weight that's being used. Pounds is used in the United States, Canada.
Thank you for your time today and teaching us about your job in a veterinarian hospital. This is Tanner Carr,
Cameron Reedy.
signing off for Faltron Elementary School.
Thank you.
Thank you, Dr. Burgess.
Yes, ma'am.